Well, actually, it is private pay, and in many instances people will ask us, does Medicare, my insurance company, cover this? And the answer is no, not at this point in time. Some long-term care policies will cover this service, but you have to read your provisions in your policy. But normally when people are seeking our services and we go over that it is, the assessment is anywhere from $150 to $450. And it gets more involved sometimes because we have to do cases for court, meaning capacity. Is the person able to make decisions for themselves? But honestly, most people are willing to pay the private rate with no problem. And then our hourly is $100 an hour. We're one of the lower rates, if you will. We've been this way for 7 years on the East Coast, and we brought those rates into the West Coast as well. So in any event, it is something that you can also, it's a service agreement, it's not a contract. So you only pay for the time you want us to do things for the client. This not only will save you money in the long run, but also save you headaches in terms of, oh my goodness, we're going to have a really huge crisis or something we can't handle in a familial way. But it's also redirecting people to also get a plan in place. And a plan is really so essential. It's the foundation of all of our lives in so many aspects, but certainly when you have a medical situation, and certainly when you have an aging population. And that's, you know, how people identify. Now, I'm so glad I found your service.
Yeah.
It's the way, you know, they respond to us. And so we've had some clients for 7 years.
Yeah.
And you know, and it's amazing that, you know, sometimes we do a lot of long distance caregiving. People live in London, relatives live in London, they live across the country, they live in Texas, and we're the eyes and ears and the basic primary caretaker of that person. We're not the caregiver because legally that's not our, but we are taking care of problems.